Well, good morning, everyone online and in person. Welcome to June's Allen County Health Equity Coalition. You folks online, y'all are deep online. I want to let y'all know we really wanted y'all to be here in person because we're not here in July, so we're gonna have to see y'all in August, and that's all right. But as we get started with today, I want us to take a moment to respect the pause, and in doing so, I want to acknowledge a person that was in my life for all of my life. It was my Nana. My Nana and I had a unique relationship because she lived in Indianapolis all of my life. In Indianapolis, and then for most of my adulthood, she lived in Greenfield, so she was always about 2 hours away. And if you know anything about being a nana or a grandma, or even a caregiver of a person or a kid, you love to get involved with the things that they're involved in. And so when you say, oh, I'm doing this now, that you want to come behind them. They're saying, I'm into painting, you're gonna get them a paint set. You know, they're saying that they're into drawing, you're gonna get them some pencils to draw. And my nana was just like that. You know, my nana was just like that. Whatever it was that I was bringing up and what I was on in life, she would mirror her gifts to me in the mail. And so there was a point in my life where I loved football. I absolutely loved football. And my nana was a faithful woman. And so she introduced me to the Indianapolis head coach, Tony Dungy. And she introduced me by way of one of his devotions. And he wrote several books of devotion. And I looked back at a memory this morning. It was a picture of one of the pages. So it's a devotion that I don't typically read every day anymore, and used to read a lot often. And I got it back in 2013. And today's verse at the top read, a person standing alone can be attacked and defeated, but two can stand back to back and conquer. Three are even better, for a triple braided cord is not easily broken. And when I hear that verse, I think so much of what we have here. I think so much of the coalition and the opportunities that we have to join in with one another, that we get this space to come alongside one another, be back to back in the field, be back to back, be triple fold as we introduce and move into spaces to come around health equity, to give people access to care, and make sure that our community is better for it. And so I encourage us to continue to make these connections, to continue to stand back to back, and continue to be in that three-fold braid. And so as we transition from that moment, and we just take this pause, just to kind of reflect on that a bit. I want us to get ready to introduce ourselves. And all you folks online, yeah, I'm gonna get on y'all every time I say to nobody, but that's okay. All you folks online, I want you to come off mute, unlock your camera if you can, and say hello. Introduce who you are and what your organization.
We actually can't hear you, Cash. We can barely hear you, like the teeniest, tiniest amount.
Wow, you guys.
I was gonna interrupt you because somebody said I was something out with it forever.
How about now?
That was better when you picked that thing up.
Yeah. What that thing? Yeah, that's on mic. Can you hear me better now?
Yes.
No? That's interesting.
Technical difficulties. Can you hear me?
Yes, I can hear you and
Now I can hear a little
Cassius.
better.
Yeah, just have to be close to the mic.
It's usually not that way though. I'm wondering if there's some kind of audio issue that's going on back there.
Everything's on.
Morning, Mary.
Turn up the volume on the thingy.
Yeah.
I turned mine up and that did help.
All right. Well, we still want to take this moment to have everyone introduce yourself. So, Colleen, since you were already so nice to share what's going on, you mind introducing yourself?
Sure. You mean I'm a big mouth, Cash? Is that what you're trying to say? Okay, I'm Colleen Carpenter and I'm with Stop Suicide Northeast Indiana. And we also have a new project focused on veterans called Action Over Silence and Veteran Suicide. Peggy Hayes, Health Vision of Fort Wayne.
Good morning. This is Sandra Thomas from Cancer Services of Northeast Indiana. I'm a client advocate here, And just wanted you all to know that we do have a young adult group, and then we will be moving into where Ward School is pretty soon. So it'll be in the community. Cancer services will be in the southeast community.
Jamira Fields from
Optimer
Bright Point.
United, oh, sorry. Go ahead.
Jamira Fields from Bright Point.
Joyce Lothamer, United Healthcare.
Hi,
Well, no-
Diane Starks, Urban Beginners Choice, Federal Credit Union.
Winoska Medina, Health Visions of Hammond, Health Visions Midwest of Hammond.
Estrella, United Healthcare Community Plan.
Melissa Martinez, Allen County Public Library.
Stacy Kazmarek, I'm with Super Shot.
Laurie Weinzaffel, also with United Healthcare Community Plan.
Looks like Brandy is left. Have we heard from Brandy? I don't think so. Maybe we're not gonna hear from, maybe Brandy has stepped away.
Brandy's from Anthem.
What about Juanita? Okay, Juanita has stepped away. All right, so let's move on.
We'll say hello to the folks in the room. And what do you want your gonna come?
Can you guys hear me?
Oh, yes, we can hear you. Can you?
Hi, sorry. I'm sorry. I'm in my car, so I was trying to click the button and it wouldn't click. But hi, my name is Juanita Roman. I am the director of grants and programs and grants for Health Visions Midwest, both in Lake County and Allen County.
Welcome, welcome. All right, we'll move to those folks in the room.
Okay, good morning, Pat Turner with Tobacco Free Allen County.
Yep.
My name is Karen Peterson. I'm with the Northeast Indiana Local Food Network.
Welcome, welcome. And you're a first time joining us?
Yes, Sharon invited me. Yes, to talk about the gill markets.
I know.
I'm Audrey Dominguez. I'm with the Allen.
Welcome, welcome.
Pepita, Health Visions staff, bilingual community workers.
Well, we just had somebody step in. So you want to introduce yourself? Yes.
I am the with the camera.
No, you're on camera to say hello.
Well, hello, everyone. My name is Mike, and I'm with the Literacy Alliance, and I'm the outreach coordinator with the Literacy Alliance, so.
Oh, wonderful.
Thank you, you're
Welcome back, welcome back. And then we have one other person before we introduce our panel for today.
Good morning, everyone. I'm Laura Berger. I'm with the system with Sharon as of a week ago.
Well, thank you everyone for taking that moment to introduce yourselves. We are excited for this month's conversation. We have a grant. We wanted to highlight some of the coalition members and clinics that we have in the coalition. And so I have asked our ED, Ms. Sharon Tubbs, to help facilitate this conversation this morning. And she's going to take us through some Q&A with the panelists, and then we'll have a chance to kind of ask them some questions as well. So get your questions ready. Y'all online, that ain't the first. I don't know if I'm gonna go to y'all, okay? I will. I ain't gonna give y'all that hard time, but please get y'all questions ready and enjoy this moment with them. And let us know if y'all can hear it.
Okay, can everybody hear? Maybe I need to move in a little bit. Here, let me do that first. Can anyone not hear? Okay, I know you all can hear me because I have a big mouth. So again, as Cassius said, my name is Sharon Tubbs. I'm Executive Director for Health Visions Midwest in Lake and Allen County. And it is very much my pleasure to be here speaking with some of these wonderful people in the community, these leaders in the community today. We have gathered together, Cassius has gathered together some folks who are working with clinics and who are dedicated to serving the underserved in many ways. And so we want to learn more about your organizations. We want to learn more about the barriers that people encounter to getting access to health and care in our community. And we want to learn how we can collaborate with you. We being members of the Allen County Health Equity Coalition and people who are leaders in other organizations, what is it that is needed in the community that we don't have right now? How can we fill gaps and voids in service? And so right now I'm going to let you all just briefly introduce yourselves and just tell a little bit, just a snippet about what your organization does, starting right here with Jayme.
Sure, thank you. Good morning, everyone. I'm really grateful to be here. My name is Jayme Yates. I serve as the Director of Community Engagement for Bowen Health. Bowen Health traditionally has been community mental health here in Allen County for several years. However, over the past 5 years, we have transitioned into integrative health, which basically means we serve the whole individual with the services we provide, and we really work hard as a treatment team to identify any barriers to access and other factors that typically contribute to poor overall health and addressing those.
All right. Well,
Carlos.
hopefully everyone can hear me. I'm Carlos Clopton. I'm with Neighborhood Health. I'm the program manager of Mission Advancement. It's a new fancy title that was bestowed upon me not long ago. So I work with Neighborhood Health, and we exist as a medical facility that offers services in medical, dental, behavioral health, chiropractic care. We're also the local headquarters for WIC. And I saw the questions that Cassius put in the that she's probably looking at, so I won't go too far. But basically, we exist as a means for the community to come, and we specialize in medical care, but also those wraparound services, and where we're connecting any individual that may come in contact with us with the proper resources that they may need on a day-to-day basis, and removing those barriers as best we can.
Thank you.
Okay, my name is Marty Goller, and I work for community, CC, it's called CCA. It's the Christian Community Health Center. And in 1996, they started in Grable, and it's a free clinic. And it does, it majors in any kind of health problems, but it also does sports, sports things. So we partner with the Hope Center. Maybe I should just tell you first that what is important to us also is just making sure that we are praying with people and that we are spiritually offering them that element also. That was kind of the force about everything that we started. So it is very Christ-centered. And so we partner with partners with a Hope Center. There's an ear and nose and throat clinic that we partner with. We have some counseling and addiction recovery. And we also we can send people if they do follow the amount of money that they make a month, they can go to Alliance, but mostly we're giving it free, absolutely free, with only a donation.
Hey, thank you all for that introduction. I just want to follow up real quick with Jayme here. You talked about Bowen and expanding some services and said that you want to now serve the whole individual. Just tell us a little bit about what that means so people will know what is new about Bowen.
Yeah, sure. So in 2020, we expanded our service line to include primary care. And so at each of our facilities here in Allen County, we have 2 outpatient facilities. We offer primary care in addition to our addiction recovery services, psychiatry, therapy, community-based skills coaching.
Okay, so when you say primary care, you mean you have family doctors
Yes,
there
ma'am.
that people can go to and all of that. Okay.
Yes, ma'am.
Wonderful. And so neighborhood health also has some wraparound services that you were talking about.
Yeah.
Is there anything new that we should know about?
Yeah, we actually have our soft opening today
Mhm.
at Neighborhood Health Oxford. So we're starting off a little slow and revving up services. Should be pretty rapidly, but we should be starting off with medical and pediatric care, prenatal care, ortho, behavioral health, pharmacy is coming soon, and that's it, behavioral health. And dental should be launching early July.
Awesome. So I took a tour of that facility on Oxford in the old Ward School. And you're going to have some rooms there, some community rooms where people can provide services. Health Visions is going to be providing some services there as well. And as Sandra mentioned from Cancer Services, they will also be providing some programs at that school. So we are excited about the different things that these clinics and new facilities are going to be offering to the community to better serve underserved individuals. Talk a little bit now, because we know that this is not easy. And underserved individuals don't have it easy right now, especially those who are undocumented. Talk a little bit about the barriers that your clients experience and ways that you want to or are overcoming those barriers. Let's start down there with Marty this time.
Well, our biggest, we didn't even know that this was going to be a problem until we started at Headwaters, that most of the Hispanic population would come and see us. And all of us are just English speakers. And so we couldn't even communicate with them. And so Lapita helps us a lot, but we have translators who come too. And I think that that was the first major thing that we really wanted to make sure that we addressed, that they felt like they could be understood and they could communicate clearly, and that were people who cared, that could speak their language and know their culture.
Good. Carlos.
Yeah, we like to see a barrier as just an opportunity to meet the patient where they are. We all see the same type of barriers, language, transportation. The big one is people think medical care is very expensive, so the insurance. So we have translators, we have language lines, we have telehealth where we put people in contact with people who speak their native language, because obviously someone communicating what's going on with you in your language is it's gonna hit a little bit different. And with our community health workers, we try to bridge the gap for transportation to help people with bus passes and that sort of thing, and Uber transportation, that sort of thing. I'm not the subject matter expert in that area, but I know they work with the patients to on some of those barriers. And we also have community health navigators to help with the insurance. So some of the 3 things that I would say is transportation, language, and the insurance. So, and we try to do our best to, like I said, kind of bridge the gap to those areas that would be considered barriers for our patients.
So you have people that help the clients or the patients apply for insurance, Medicaid?
Yes, and all the NCEs. So we have them there. They're gonna be like, what we call them is their fighters, because there's a lot of things that happen along the process for applying for insurance, and we try to fight for them. And they have more of a direct contact with the insurance company, so it's a little bit easier for them to do it.
Okay, wonderful. Yeah, Jayme, what are some of the barriers?
Yeah, so I definitely agree, excuse me, with Marty and Carlos, and those are some common barriers we see for populations that are typically marginalized and don't have a lot of access to care, transportation, insurance. Absolutely. And I would just include that Bowen Health, we also have community health workers, and behavioral health consultants that help bridge those gaps. And so there's a lot of factors I mentioned earlier, a lot of factors that can contribute to poor health outcomes. Those are some of the factors. In addition, I would include that we also see a barrier in terms of access, meaning that a lot of times in healthcare right now, if you call and you're ready to get the service, it takes a long time to get in. And so really what we're trying to do is continue to hire those providers who not only are very skilled in what they do, but they really care and are passionate about the population that we serve. And so that's really important to Bowen Health, and I'm sure the other panelists and the organizations they work for as well. The other barriers that I see are awareness, just lack of awareness of what is out there in the community. And so I actually was fortunate to, I took a tour of the Allen County Jail a couple weeks ago, and I was able to talk with the gentleman who just graduated the JCAP program in the jail. And that was the main thing that they said is like, at some point, we wanted the help, we just didn't know where to go. And so the awareness is a huge piece and a big barrier for a lot of people. So for Bowen Health, there's a misconception that services might cost a lot of money, which Carlos just said. But in reality, we'll serve you no matter your ability to pay. And we have things in place like a sliding scale fee. We have what's called charity care that we can provide if you're under a certain income and you can't pay for services, we'll give you those services anyway. And so there's just a lot, especially within the FQHC or Federally Qualified Health Center model that allows us to serve these specific communities and remove those barriers.
I like what you said about community health workers, because of course, Health Visions is all about community health workers. We train community health workers, but community health workers are the ones who can bridge that gap between what people think and the resources that are out there. They traditionally are the ones, and I'm assuming that's true with Bowen, who connect people with the resources that they need. Yeah, so that's a huge one. I want to talk a little bit now, piggybacking off of some of the things that you all have said with regard to barriers and how people think that the healthcare is going to cost more than it is, and the awareness and the resources that are out there. Let's talk a little bit about the political situation in our community and in our nation, because while we're saying that these services are available, there are real threats to Medicaid. There are threats that people who are undocumented and Spanish speaking are feeling right now, because there is that real threat of deportation. Talk about how the political climate has affected the services that you offer, just the tone of how you provide those services and clients when they come in. Anyone want to start?
Yeah, absolutely. Okay. So yeah, absolutely. That's been a big topic of conversation for obvious reasons. Bowen Health will maintain the services that we provide. Our allegiance is to the individual. And so while in reality, yes, there is a political climate and they could affect Medicaid services, but we are taking the stance that we will serve anyone regardless, and our stance is the same. I think the way that it has impacted us most is that we can, and I meant to say this earlier when we were talking about barriers, stigma and culture is a huge barrier, right? And along with the political climate, I think it's even, there's been a stigma with mental health specifically, but I think even with this political climate, that's emphasized just stigma across the board and those types of things. So it hasn't made it easy for people to come forward to organizations because they're scared, and I understand why. And so the way that it's impacted us is just continue to create awareness among our providers. We really strive to have our providers understand that, again, we're meeting the patient where they're at, And we know that they are the expert on their experience, and we have them inform how we are going to respond with treatment. And so I think this is just another layer of ensuring that our providers who are working at Bowen Health are understanding how the climate is impacting our patients and using that in treatment and understanding that when we have a patient in front of us that we're trying to serve.
Okay, good. So you're saying that the climate is affecting the patients, but not the services?
The services will remain the same.
Carlos, what do you have anything to add there? Because I mean, neighborhood health needs to get paid.
Yeah.
So what would you say to that?
I think initially there was a lot of, scattering ants, when we were kids, like pour water in the ground and watch the ants scatter. I think that was kind of everyone's reaction. If it affects anyone in this field, it affects everyone. We're all trying to see what to do. But I think, like she said, she mentioned FQHC, but also the HRSA. The HRSA is an umbrella for the FQHC. And, that clearly states that we have the obligation to not turn anyone away. So that's the bottom line of why we don't change what we do. It really impacts services and, it really impacts patients and their trepidation coming in for appointments because they kind of lost that sanctuary aspect of it. But we're watching and we're maintaining, making sure we're staying educated and informed on, there was a scare where there was a potential postponement of payment, everyone that got shut down, thankfully. But I think what we'll do is, kind of like Jamie says, continue to do what we do well and watch it and monitor, but we have an obligation, we're gonna continue doing what we do.
And with just clarification, you said HRSA?
HRSA,
HRSA,
yeah, HRSA is the umbrella for all of the qualifications and the guidelines that we have to follow and maintain.
Okay.
As a FQHC.
So I'm sure that's an acronym for something really
Yes.
long that we don't need to get into now.
Yeah, this is a big director here. She probably knows what that
Okay.
But yeah, that's what we're guided by every day.
Marty, did you have anything to add?
Yeah, I think because we are free and that anyone can come, we don't send anyone away. And I think my job at there is to pray, and I ask them if they'd like to pray. And excuse me if their stories about how to get here and what has happened to them as they have come and how they are so afraid. And it is free. Anyone that we send them to, we say, we trust these people. They are not going to ask who you are or where you came. They're going to just give you services. And especially since we pray, we kind of do a little bit of counseling also to help relieve their fear that we're not going to turn them in. We're not going to not see you. We're not going to give you the best service that we can. We are here and we don't care at all where you're from, but we are going to give you the services that we can provide. Now, we are not established as well as you folks are, and yet we've got a vision to continue to do and give this to them. And we always ask, how was your visit? And we always get 5s. It's because they feel like they're safe. And I think that that's the one thing that really, they just kind of come in, they get services, we love on them, and we send them out. And I think they feel safe, they feel heard, and they feel important. And I think that that's kind of what we give to our clients.
That's interesting. Thanks so much, Marty, for that. Carlos talked about that sanctuary aspect that some people are not feeling. And that's something that you're trying very hard to maintain there at the Christian clinic, and that you're praying for them. Before we go to any questions that people have in the coalition members online and in the room, Marty, you got emotional there a little bit.
Yes.
Can you share with us maybe just briefly a story of that you've heard from about someone in the trials that they?
Yeah, I will. But first of all, I want to tell you that I'm a mental health counselor, so that I'm not supposed to say anything.
Oh, okay.
But I can say if you don't know and you're not, okay.
Okay.
I asked a couple, and I said, how can I pray for you? And they had some health issues, but they said, we are afraid that we are going to be sent back. We are afraid that we are supporting our family. We are sending money back so that our children and our grandparents can take care of those children, that they can have a life. If we are sent back, I don't know how we are going to live. Here's another story. She said, I brought my child with me when we crossed the border. And she was a very beautiful little girl, and she had been raped by some of the people who were, and I'm sorry, this is very graphic, but she said she was raped. And I knew then that I should not have brought my child, but then there was no one for my child to be with. It was just me. See, I had no choices, and she felt so guilty. And I just said, no, you were looking for a better life for you and your daughter. And the evil around you did that, not you. And so, and that's just two stories of the many, many months that I've been praying with people. And up in Grable, there's Amish and there's other people who come, and they feel marginalized also. And so a chance for us to sit and say, God doesn't care, what you wear, He is there. And so it's an opportunity for them to feel heard and cared for in a way that not always are they. And is that okay?
Yes, thank you so much for sharing that. We appreciate that. I'm gonna open it up now for any questions that people have in the room. Do you all have any? Pat?
Yeah, so we know that there have been raids. I'm gonna call them raids by ICE. So do you all have protocols in place if those folks came to your places and wanted to access your patients?
Do you all know of any protocols?
I mean, I'll say that there's not necessarily a protocol for that. If they would come into our space, and we have no jurisdiction over that, we would have to comply. Yeah.
Okay, so it sounds like the same, Marty, you would have to comply.
Yes,
Yeah.
ma'am.
And Carlos, I'm not sure if you know the answer to that with regard to neighborhood health.
Yeah, I know we have a protocol in place, but it's very high level.
Okay.
We have people in charge to handle that.
Okay.
Do you have sessions with your clients to prep them for a possible scenario happening like that? Do you ever have conversations with them or provide them with resources that they can go to, that kind of thing?
Anybody wanna take that one?
It's a fringe because at this point, there's also been the potential of advocacy looking a certain way so I mean, we try to provide the available information that's out there, but in a lot of situations, our hands are tied. That's just.
Yeah.
No, I'll say that I think that there have been real fears around this, and that tends to come up in conversations with our providers in therapy. And so really, we try to focus on what we do best in those situations, which would be to provide that therapeutic treatment. And yes, we do link to resources if it is appropriate for each scenario. We absolutely will link to resources. I think that absolutely, like, community and being able to process in a group setting or even talk to somebody who's going through something similar, I think can be extremely beneficial for some. And so we just try to gather, like Carlos said, all of the available resources and be well versed in what is going on in the political climate so that we can respond appropriately and within our scope.
Thank you. Cassius, are there any questions online? Are there any more questions in the room? Okay, go ahead. Yes.
So I know that neighborhood health clinics is a FQHC. Are you also an FQHC?
Yes, Bowen Health is an FQHC.
So.
And can we say what that means again?
Federally qualified health center.
Okay, for the folks who didn't hear it the first time, for people in the back. Go ahead.
So the cigarette tax was passed. They're going up $2 a pack. So are you gonna amp up your tobacco cessation services?
We have a person that does.
I know you have a
Yeah, I
TTS.
think we have another one as well, so.
Good.
We could ask them in the plan to try to take advantage of that.
We'll be in touch with you.
And Pat, remind people who you're with.
Oh, okay, I'm with Tobacco Free Allen County and I'm the outreach and education coordinator. I'm a certified tobacco cessation facilitator as well.
Yes, ma'am.
Yeah.
Yeah, thank you for what you do. Bowen Health, we've been having conversations around tobacco cessation. The seriously mentally ill population, they are 20% more likely to use tobacco products. And so we're really focused, again, we have that obligation to serve the whole person and to understand the population that we're serving. And so tobacco is one of the things we have been over the past year. We have been in this phase of collecting information that from the patients that we serve regarding their tobacco use. And if they would like to quit, then we're able to provide them with resources. Next fiscal year, which starts in July, we're moving into a new phase of that, of providing intervention and treatment that is evidence-based in addressing tobacco cessation. We're also providing it's out of our Rudisill office, but it's virtual. We're doing a tobacco cessation group for adults. Yes, ma'am. Yeah, so we need to connect, Ms. Turner.
Can I ask what that looks like for you? I don't want to, I just want to know what it looks like for you, because you said you have your.
Well, yeah, so we're not doing classes currently, but we use the Quit Line as a resource for individuals. We encourage people to use the Quit Line because it's very successful. They offer free counseling, of course. You get a quick coach, and also provides nicotine replacement therapy, either the gum or the patches. If you have behavioral health, or you're pregnant, or you're using menthol products, you get extra help, more nicotine replacement therapy, more counseling. So those are the things that we encourage.
Mm-hmm. Is that a free service then?
Yeah, we need to get together too.
Yeah. I like free.
Okay, I'll give you my cards before I leave.
And Tobacco Free Allen County is one of the resources that we do give to patients. If they're like, yeah, I want to quit, then we provide that resource to them. Yeah. Yes, ma'am.
Yes, I just had an experience when you were talking about the tobacco. I know that public housing, subsidized housing, I have a relative that's actually in a public housing, and it was done improperly, but they're really trying to enforce no smoking in the buildings. And the way they've done it has been so rude and inconsiderate. But I know there's some places where you need to go, because as you were saying, the mental health and low income, that's one thing that they have access to is tobacco. And now that serene of comfort of smoking inside your apartment is no longer, so that they can actually be evicted, I think as of May of this year. So there's a lot of work for you guys to do.
Yeah, you haven't been able to smoke in public housing for a while.
Well, but they no.
You haven't, not housing
Well,
authorities.
it all depends on what side of town you live on, okay? No, I'm telling you what I know.
Okay.
I'm telling you what everybody told me.
Okay.
And so they do it in all of these places. And in the process of me caring for individual, even trying to move them to another location where you have affordable housing, it is the same problem everywhere on the southeast side of town. So I hear you.
I know you can smoke in places where you get use vouchers, but in the housing entities like McCormick and those places, they've been smoke-free. They're supposed to be smoke-free.
They're supposed to be, but that's the differentiation. Yeah.
Actually, classes
Okay.
on site for them when they first went smoke.
But a lot of the subsidized home, not McCormick, yes, I mean, I can familiar with McCormick, but there's a lot of places. Just so happened my relative quit smoking.
Okay.
On his birthday, and I was able to clean up all the nicotine, get rid of all the nicotine, cold turkey on his birthday.
Well, that is a win for health.
Yeah, that's a win for
Yes.
health. So I'm just here to say that,
Mhm.
yes, it might be free, but the confidentiality and some of the things that some of the people that are on subsidized payment or whatever, they don't trust a lot of these agencies, okay?
Yeah.
Because you have to go through this and that to get to you. They don't trust you. So I just say you have a lot of work to do. That's all I want to tell you. Keep up the great work. Keep up the great work.
Wonderful. That's a good point about the hesitancy. We saw that publicly at the forefront publicly when COVID was here. And the hesitancy with regard to people in underserved populations getting the vaccinations, right? And because of lack of trust of the healthcare industry. So I'm sure that that's something that all of you are aware of and are trying to combat, or I hope so, like she was saying. And what you were talking about with Pat is definitely a collaboration, okay? And so for our last question here, unless there's something online, for our last question here, want you to just briefly talk about how we as members of the Health Equity Coalition, how our organizations can best collaborate with you and what you would have to offer some of the people, our participants or clients that we see. So it's twofold. How can we collaborate and what you have to offer? Who wants to go first? Jamie's ready.
Yeah, I think that we owe it to our community to collaborate. I think that there are a lot of people that we're not serving, and the only way that we're going to help them is through collaboration and working together. To answer your question about how Health Visions can collaborate with us, I think.
Or any member of the coalition.
Yes, or any member of the coalition. So I think that continuing to talk about the barriers and how does it make sense for us to come together as a community to start addressing some of those barriers and send a united message, but also maybe combine our efforts and our minds and our talents and skills on really making impact in those areas. It seems that if we're siloed and if we're doing our own thing and not collaborating with one another, then a lot of times we're just kind of working against each other because the right doesn't know what the left hand is doing, right? So I think the collaboration and continuing to communicate about what barriers we're seeing and how we can start solving them and making progress is needed. Also, I'll be brief, but we talked a lot about some of the barriers that we're seeing, and one of the main things is lack of trust in the community. So let's, yeah.
It's real.
Yes, absolutely. And it's real, and I understand, I get it. I understand why there is a lack of trust with the healthcare model in general. And so my good friend Jonathan, him and I always talk about humanity 101. Let's just start treating people as individuals. And I think that, just continuing to send that message with our providers, with everybody that we come in contact with, and start building that kind of response to treatment and meeting people where they're at and listening and hearing. And that's probably why you get 5 stars all the time, is because people feel heard when they go to you and they feel safe to come back. And we need to really start creating a sense of humanity within our industry and across the board.
We're outdated.
Yeah, across the board. Yeah.
Okay. Awesome. So Carlos, again, how we can collaborate, any organization, what gap can we fill, and then what you would have to offer?
I think there's a bunch of small conversations that lead to strategic planning, and then like conversation with that turned into an event that we had post that Oxford. It's just a bunch of small conversations and collaborations that end up leading to something bigger. And it could be events, the event this Saturday. A lot of that is I just go around the table and find out what they do and how we can bridge the gap. Right there, a lot of those conversations come at events just like that. So shout out to Cassius.
And we'll talk about that event on Saturday in just a few minutes.
Yeah, but I think that's essentially what it is, having an open mind and then just taking, some of it exists, some people, we don't have anything that tangible to have an event about, but you can come to our location and talk to our patients, and the patients can hear how we're collaborating with other community partners. Some of it exists as that. I think what it looks like is different for every organization, every conversation. Like I talked to him, what's your last name? Jackson. His name is Michael Jackson.
All right.
So I talked to him a while ago about how literacy,
yeah.
How that impacts healthcare. So all of these things, some of it seems disconnected, but it just takes a simple conversation to learn how you can bridge the gap and come together and collaborate. And I think, what was the last part of it?
What you can offer.
What I can offer?
Neighborhood health.
Oh.
And maybe you have some special things to offer for.
Maybe a smile, maybe a hand. No, but neighborhood health, like I said, just remind all of our services. We have medical, dental, behavioral, optometry, chiropractic care, WIC, global headquarters for WIC. And we have inclusive dentistry coming as well, in which we're using sensory data to help people who have anxiety about coming to dental appointments and all that sort of thing. And so I mean, there's a lot of things that we can offer, but I think the collaborative aspect is what I want to highlight, because I think it all starts with conversation and where it goes to. You know, sometimes it takes on life over something. Yeah.
And you can have those conversations right here every month at the Allen County Health Equity Coalition meeting.
But then you gotta also get into the community where the people are.
Yes.
We can have these meetings all we want, but if you don't make yourself available and bring that real humanity, what you say in front of a camera, and you don't make it real life. And I have to say, Carlos has really been a great voice for neighborhood health in reference to coming on. He attends our neighborhood association meetings and try to take some feedback, because my voice is really, I'm not mean, I just mean business when I speak for my community. And so I really thank you, Carlos, for being that outreach, and I tell you that all the time.
She's passionate. She's not very passionate.
I'm very passionate, and sometimes people get my passion for anger, this and that, whatever, but I really mean what I say, and I stand on what I mean.
And can you just briefly identify yourself for the folks online that can't see you?
I'm the president of the Oxford Street Association, and
Name.
with my passion,
Name.
My name is Diane Rogers, and I actually built my home in an area that was not to allow me to stay as long as I have. And I know that I have been a voice for those new residents of Burmese, Hispanics that have come into the community. And I have a different challenge of trying to deal with them, because they have been advised by whoever told them on their journey to not communicate with me. So my job is extra hard, because I don't have a title. I don't get paid. I'm just here in your face telling you welcome and what can we do together. And I've been protecting for a long time and still in the business of doing so. So I appreciate you, Carlos. I won't be there for your celebration, but I'll be there when the door opens for real.
Wonderful. So point well taken. You know, don't expect the people to come to you. If we want to really break down barriers, let's get into the community by going where the people are and making ourselves seen. Marty, we'll end with you.
Yeah, I think that that's why we're at Headwaters, because that's around the Wells area. And I think that that is, first of all, some of them walk in. They don't have and so they're there. And also, I think the time, most of the people that we serve have to work, the 8 to 5, the 6 to, they have to work. And if, yes, and if they, so we have evening hours at Grable, and when we maybe start the new facility that we're going to try to get there on Wells, we'll have some evening hours. But the cost and the time, the cost is they are just strapped. And then the trust, they are so People who are marginalized are so afraid that they're not, they're not going to be cared for. They're not going to be listened to. They're just going to be like, oh yeah, here, just take this pill and leave. We don't really care. And then I probably will get fired.
Uh-oh.
Hard to say this next one, but.
Don't say that. You're not gonna get fired.
All right.
You're gonna get lifted.
All right, okay. There is another dimension in all of our lives, and that's our spiritual dimension. It's very, very important to understand that we are going to live forever, and where are we going to live forever? And I think that that's the other piece. I think that's the other piece that we bring to our clients, is that we have the ability, and we say it straight out, you know, we will pray with you. We will be here for you. What can I pray for you? You can bare your soul, and we are going to pray for you. We're not going to tell anybody. We're not going to report it. You're going to bare your soul. Now, if they say they murdered somebody, we report that. There is that. Okay, you understand that. I know where that boundary is. But that spiritual thing that happens when we pray with them, and when they come in and they realize that their faith can be acknowledged also, that it's important. I think that that to me is the complete package.
Thank you so much, Marty. We really appreciate you. And Diane has stood up. She's got a shirt that says faith. And so we really appreciate you. We appreciate all of you for being on the panel today. We have learned so much. Hold on. Let me finish this little statement. We have learned so much from all of you in the work that you do, and the barriers that the underserved face, and how you are really working to get those barriers depleted, to break those barriers down. And we can see each of your hearts and how you want to serve. And so we thank you. Carlos, your one last comment.
Yeah, I just want to let everyone know, and on the, I won't be cautious. I'm kind to the people on the, online.
Oh
as
my
well.
goodness. What's going on here? Inside joke.
Okay, I'm sorry.
Okay.
Just want everybody to know that you're welcome to the open house on July 7th, 5 to 7. Tour the facility, get a brief introduction to all of our service lines. Everyone's welcome, but.
The open house where? Where's the open house?
Except the competition.
3501 Warsaw.
3501 Warsaw, the new neighborhood health Oxford location is opening, when is that again?
The soft opening is today.
Okay, soft opening is today. All right, so you can get some more information from Carlos. Thank you so much for this panel discussion. We appreciate you. They did an awesome job. Thank you. Cassius.
And I want everyone to know that the Oxford community came together to save the ward building for community. That was my voice, the children in the community and around the community that saved that historical building for it to do awesome things. And I'm expecting to do awesome things. And I want that of overflow that the community has. I want it to go over into the community. So the abundance that you guys have, I'm manifesting that for my whole community. And you know that, Carlos.
All right, Diane. So Diane is just referencing the community effort a few years back.
Yes.
That saved that building. We thank you for that reminder. Carlos, what are we doing now? I'm sorry, not Carlos. Cassius. I got mixed up with my C's.
Thank you again, everyone on the panel. Y'all can hear me online. Look out, and got me tested now. Listen, Carlos said it. He want to be kind. I'm being kind to y'all. The invitation is open for y'all to be here. Y'all always gonna hear in the room. So July, we won't be here. So August, you could plan ahead to make sure you're here on August. I'll send that date in the email. But before we end today's meeting, we want to take a time and talk about what Health Visions has going on, and then we want to hear from you. So Health Visions, this Saturday, June 28th, we'll have our 4th annual Community Health Fair at Fellowship Missionary Church, 2536 East Tillman Road. We have a jam-packed day for you all. Lots of information.
I won't be here.
That's okay. Lots of information, but wonderful events
Yeah.
going on throughout the day. We'll have 4 live concerts. We'll have free massages. We'll have free food for the first 150 people. We have a phenomenal keynote speaker by Mr. Terrence Friesland. If you haven't heard Terrence, go check out our May mental health panel that we had last month. It's on our YouTube, and it'll be a fun day from 11 to 2, 2536 East Tillman Road, Fellowship Missionary Church. If you're not already signed up and you're still like, man, hold on, we want to come. Email me. We might be able to squeeze y'all in.
Well, someone from BuyPoint said I'll be there.
Well,
So,
yeah.
okay, come on. And tell their clients and
Yes,
spread the word.
Please share. We'll have Spanish and Burmese translators on site to help everyone have an enjoyable time. So please show up. And then
You had me at free massages.
come on now. And then on July 31st, we are having a community health worker, I'm just getting my community mixed up. Community Health Workers Summit. It's our first one that Health Visions is partnering to host, and this will be located at Crown Point. And so it'll be July 31st from 10 to 2 p.m. If you have been a community health worker, if you're thinking about becoming a community health worker, or if you're just in the social world in general and you would love to join in on this phenomenal event, please, we'll send this flyer in the email so you guys are aware of it and you can find out more details, but we're gonna have a good time there. So we would love to see you all there. Please share it to any community health workers that you may know, or if you yourself are interested, let us know as well.
Is Juanita still online?
She is not on.
Oh, okay.
She was not here to share. And so that.
I'm still here.
Oh, she is here. Juanita, please, yes, if you want to add some more, please.
Hi, Cassius did a great job of kind of summing it up, but we're excited to partner with INCHWA, the Indiana Community Health Workers Association, as well as IWIN, Indiana Women in Need, to throw this summit, and we're excited to have it in Lake County. It is at the Crown Point Public Library. The address is on the flyer. We also have vendor opportunities for organizations. And again, you don't have to be from Lake County. You could be, because we're sending this out throughout the state. So any organization who would like to come and set up a table, there are different levels of registration available for you to consider. And while there isn't going to be general public there to promote services, it's a summit for people working in the human service profession, as obviously targeted towards CHWs. So it would be an opportunity for organizations to share their resources with the individuals working with the people in the community. So then that way they can pass along that vital information. Lunch will be provided. We'll have a lot of great speakers, a lot of great topics. Ms. Sharon Tubbs, our executive director, is providing the keynote address on embracing your calling and conquering adversity. And as well as a lot of other speakers, and INCHWA is going to also do a lunch presentation, and we are also going to be doing some recognition of some of our CHW champions from throughout the state. So again, if you are interested, please follow up. I know Cassius is going to be sending out the flyer, the links. There is a registration, and we do have a cap, so it will be first come, first serve. Because we can only fit so many people in the room that we have, but we're looking forward to seeing you guys.
Not that far of a drive to
No,
Lake County, so yeah.
And it's 10 a.m. Central Time, which for you Eastern folks is great because that's actually 11 a.m. Whereas when Sharon knows when I'm coming that way, you guys skip an hour ahead for us, but you guys will gain the hour. Yeah.
Can I just add that I'm working on the press release, so I learned a little bit about this yesterday. The registration fee is very reasonable. The sponsorship rates are also very reasonable, and they help support the CHWs.
Yes.
Thank you so much for sharing that, Laura. I forgot. The registration is just a basic. It's $25 for a person to attend. There is a $60 vendor fee if you want to have a table. That will include two people to attend and register. Throughout the summit, we will have breaks and networking opportunities for people to actually walk around and talk with the vendors. And then there are 3 sponsorship levels, 250, 500, and 1,000, and different levels come with different levels of marketing for your organization. And all that info is on the registration link, and all of the funds, any funds raised goes towards our CHW certification program to help provide maybe some financial assistance to those who can't afford completely to pay for the CHW class and other expenses to support that program.
Thank you, Juanita.
Mhm.
All right.
Now, if there's any announcements in the room or online.
I saw Colleen had an announcement.
I was seeing she wanted to say.
Okay.
So Colleen put it, oh, yep, she did come on.
Hi, everybody. The Action Over Silence to End Veteran Suicide project is having a free in-person suicide prevention training this Friday from 1:30 to 3:30, and it's being held at AWS Foundation out on West Jefferson. And you learn how to recognize and respond to suicide thoughts that maybe service members or veterans might be having. However, you know, what you learn also applies to non-veterans as well, civilians. So we'd love to see as many people out there. It's free. And there is a Facebook link in the chat, and there is a registration page. I sent it out, and those folks online can see it and use it, but I apologize to the folks in the room. Cassius, I was out of town on vacation when you sent out the last call for sending out announcements. So I apologize that I missed the round of Health Vision's kind of announcements of upcoming events, but there you go.
Colleen, this is Pat Turner. Can you send me information about that?
Yeah, absolutely. Yep. I can do that. And also just a big save the date for a September event called Empowering Minds Together. It is a mental wellness conference, all-day conference with 2 keynote speakers, lots of breakout sessions, and it's focused on all sorts of wellness approaches. We know that mental health therapy is out there, and a lot of folks are willing to use it. Some folks are not willing to use it, and so we're also promoting other ways to become well, other strategies for becoming mentally well. And so I will be sending more through Cassius and his awesome email blast once a month about that. But September 12th, Purdue Fort Wayne, probably starting at 8:30 and ending around 4. So thanks.
Right on. Well, thank you so much, Colleen. Is there anyone else online or in the room who has something they want to announce? Yes.
I have a diabetes intervention class in Spanish. It's gonna be 8 sessions, and we're gonna start on July 9th. It's gonna be a Wednesday, gonna be running on Wednesdays, and it's gonna be from starting around 9:30, and we gonna help people to lose weight. They have an opportunity if they apply themselves to revert prediabetes and learn to control their diabetes. They're gonna learn about nutrition. And during each of these sessions, we check the blood pressure and we check the sugar levels. And the last class that I have people that were able to lower their A1C half and lose weight and revert diabetes. And if you have clients or you know someone and they are Spanish speaking, they can come to the class. I'm gonna be facilitating with Genia starting July 9th.
Here. Here. Wonderful. Awesome. I know Karen has something. Is it?
I just wanted to make everybody aware that we're in the farm market season, so the fuel markets are starting back up. Health Visions was involved for many, many years And this year we have made some changes to the schedule. So we have, the markets are going to start the week of July 7th, so right around the corner. Mondays will be at Johnny May Farm, from 4 to 6, and Thursdays will be at the Parkview Health Greenhouse, same from 4 to 6. So the heel markets run for 8 weeks. And what's unique and probably most interesting to you guys about why they're helpful from a health perspective is at the heel markets, we double SNAP, WIC vouchers, we have aging in home service senior vouchers. So if anybody has access to those incentives, their money goes twice as far. We have folks on site from WIC and from aging in home services at the heel markets. They won't be at the first Johnny May just because of the holiday, but they'll be at the second Johnny May and all of the heel ones. I'm sorry, and all of the Parkview ones. So VeggieRx too, if anybody gets VeggieRx for some prescriptions, those are methods of payment that are available at the market. So we're just hoping to get the word out. I mean, you mentioned awareness. That's our biggest challenge. People don't know that these programs, I've got 20. People don't know that these programs exist, especially the seasonal ones, because they come and go, right?
Yeah.
And I've got extras if anybody needs them. But the second program I wanted to mention just briefly is SNAP Double Up. So for fruits and veggies, people can go to vendors that have that are accept payments for SNAP Double Up. Pontiac Street Market is one. The Fort Wayne Farmers Market is one. Plowshares at the Market is another. So that's a everyday opportunity for folks. So if convenient, if you guys can help mention those opportunities to the folks that you work with, that would be great. One of the things that I'll also finally mention about the heel market, because we talked about the Burmese, we've got some changes this year in the market operation for the heel markets, and the Burmese vendors are actually taking a much bigger role, which I'm really excited about. And so they'll be at both markets and everything else. So because these markets occur in the community, we want the vegetables and the fruits to be, you know, interesting, palatable, and relatable, and all that. So there's a lot of work going on to make sure that they're successful. So anything that you guys can do to help us get the word out. The flyers are helpful. Got some mailers going out too. We go to see everybody at the heel markets. They take cash too, so you don't have to be, you know, on an incentive to come. It's we want it to be a community event. So we hope to see everybody there. And if anybody has any questions, come and see me afterwards.
And do you have an electronic flyer that you can share with Cash?
Yes, yeah, I sent it to Sharon, but I
Perfect.
sent it to Cash. Yes.
Oh,
Right
send
on,
it to
right
Cash.
on. Thank you so much, Karen. And
Yeah.
as she's mentioned, because some folks had some trouble online, July 7th, the first Johnny May opens up on Mondays, and then July 10th, Thursdays, Parkview Greenhouse, Hill Markets. Now with, and then what was the organization again that you were?
Oh, I'm with the Northeast Indiana
North-
Local Food Network. So we're just doing a lot of the community outreach for the markets this year. So that's sort of our role.
Right
And I
on.
manage the Double Up program in Allen County too. So if any with same job.
Okay, sweet. And so thank you so much. If there's no other announcements.
I have one.
Yes, please, no, you're okay.
Just wait for that. Okay. I just wanted to share some free resources that Bowen Health provides on our website. We have master classes online. They're free to register. You don't have to be a patient, but they take place online. The times are either 11 a.m. or 2 p.m. and we host them weekly. We do have some like tobacco cessation and vaping, resources, but then otherwise the topics are mostly related around just maintaining your health and just living a healthy lifestyle and some techniques to do that. We also have a podcast, similar. I think we launched it on the 6th of June, and the first topic was related to autism and identifying. I think it was around identifying symptoms of autism, and so it's held weekly as well. They're brief podcasts, and you can also access that from our website. And then the third resource that we have is a blog. And again, just a variety of topics related to mental and physical wellness.
And what is that website that we can access those resources?
So www.bowenhealth.org.
bowenhealth.org.
Yes, ma'am. And I also brought flyers. You're free to take some on your way out, and my cards are there as well.
Well, if there's no more announcements, I know what I'm like there. Online, August 27th, that's our next meeting. We will see you there. We're taking July off. Enjoy that summer month. And we'll see y'all all Saturday. Thank you so much.
Awesome.
Thank you. Bye.
Bye.